Hello, my name is Tiffany Hogan Alvarez. Thank you so much for joining us. With that, it is 6 o'clock, and at Chrysalis, we know the importance of punctuality, so we like to model that. So I would like to invite our President and CEO Mark Loranger to kick it off for us.
Hey, thank you very much, Tiffany. Tiffany is just a superstar in our marketing and communications department, but she has also become a Zoom host extraordinaire. So we feel very fortunate to have her. Thanks for helping us with these, Tiffany. So thank you all for joining us for our third community broadcast. We've done these internally for a while now. In fact, we're doing them every Wednesday morning at 11 o'clock, and we're really delighted to be able to do this with stakeholders in our external community as well. Some of you have joined us for others of these, and some are new. So thanks for taking some time out tonight. So our format tonight is we're going to have a roundtable discussion with a number of key staff members from throughout the organization that work directly with clients. Bianca Smith, who oversees our Santa Monica Center. David Milan, who's a senior employment specialist at our San Fernando Valley Center. Josh Gazine, man, I worked really hard, Josh, to get that pronunciation right. I got close. Josh, who oversees our downtown center. And then as Tiffany mentioned, we've got a few questions that have come in that we'll get to at the end and try to leave a little bit more time than we have on past broadcasts to do that. So let me just set the stage a little bit for a brief update on how we're doing at Chrysalis. We've now been in this virtual services mode for about 6 weeks, and we're figuring it out. In fact, we are busier than we probably ever have been for a lot of different reasons that you'll hear pieces about later on tonight. Since we began offering virtual services on March 16th, we have helped over 2,400 clients engage in meaningful back and forth discussions, either by phone, by text, by email, by video. It's pretty impressive given how the community has responded, our client community has responded. And our focus has really been on meeting our clients where they're at. So if they are ready to find work, to get back into work, we can help them do that. In fact, we've helped over 130 of our clients do exactly that. But for a lot of our clients, their needs are different than that. And you'll hear some of those stories directly from our team. Chrysalis Enterprises, our social enterprises, continue to be very busy providing essential services throughout LA and Orange counties. In fact, last Friday was payday, and over 390 of our clients received paychecks from us. So I think we are becoming one of the larger employers in LA these days. And of particular note, this week we have 110 clients that are working at Project Room Key locations. These are the shelters and hotels that have been stood up by the city of LA and the county of LA to shelter our most vulnerable individuals in the community that have experienced homelessness. And so we're very proud that we were able to partner with the city and county to help support that effort and provide opportunities for our clients to do it in communities that many of them were or are still a part of. It's something we're really proud of. So if you've been following Chrysalis for a while, if you know much about us, you know that we have a very metrics-driven culture. Measurement and data is a big part of what we do. We do it with a very large heart. We collect data and information and metrics because that's the best way we know that we are impacting our community most effectively. But over the years, if you've heard me talk, you probably have also heard me say that I know that many of the conversations that take place in our offices every day have nothing to directly do with clients' employment. It has to do with more basic needs. And we call many of these things groundwork issues, things like housing, financial stability, and issues with the criminal justice system, all things that need to be resolved before we know they'll be able to successfully move on and hold employment. Well, now more than ever, these conversations are ramped up to a whole nother level by our staff. A recent USC study that came out last week, published in the LA Times, indicated that 45% of Angelenos are currently employed. So that means 55% are not. Now that includes kids and includes folks that are out of the workforce, but still over half of our community is not working. And that's a huge drop in labor participation rates. And We also know that the clients that we serve, the communities we serve, people of color in particular, are disproportionately affected by both the economic crisis that we're experiencing, but also the health crisis that we're experiencing. So we are really feeling that in a big way at Chrysalis through the connections that our staff are having. So tonight we wanted to share some of those stories, tell you a little bit about what the front lines from the perspective of the staff that provides those services is like. And to get that conversation started, I'd like to turn it over to Bianca Smith.
Thank you, Mark. Hi, everyone. As Mark mentioned, I am Bianca, our Santa Monica Center Site Director. As Site Director, I oversee our daily operations and lead a team of employment specialists and other staff. And at this unique moment, I am actually covering some of a caseload and working directly with clients. So what am I seeing and hearing are our clients' experiences? Well, first and foremost, clients still want to work. They understand that there's a pandemic going on, but despite that, their initiative and drive to support themselves is still front and center. And to do that, they need and want to work. But there are some barriers to that. And the first one that we're seeing is access to technology. On the West Side, about 70 to 80% of our clients are unstably housed. So that means that they don't have access to a computer or internet access, or even a place to charge their phones. So at Chrysalis, our staff are spending many hours helping clients apply for jobs online, checking their email if they're comfortable giving that information, and identifying spaces where they can find an outlet to just charge the phone. One of the hurdles that my team specifically in Santa Monica is facing is that roughly 20% of our clients we haven't been able to connect with. And that's because these individuals are likely among the most vulnerable, as they may be included in those who are experiencing street homelessness right now. So I'm going to try something different this week. When I go into the office on Thursday, I'm going to create a leave a note notice and put it on our front door. Our hopes is that these clients that don't have access to a phone or email right now are passing by our center, seeing if we're open. So hopefully they'll see this note, actually leave one, and come back on Fridays when we do have someone in the office to connect with. Another big issue that we're seeing is food insecurity. People don't have a place to store their food, and so they're really reliant on food banks and meals provided by our homeless provider partners in the community. But even then, access can be an issue. On a positive note, though, those with an address, their CalFresh food benefits can now be used to purchase groceries online through Amazon and Walmart, which is a blessing. Another thing, the emergency funds that our donors have helped raise are also a big help. Our employment specialists are now enabled to provide direct support to clients in need. Another challenge that has arisen is public transportation, and not because it isn't accessible, but because just like everyone else, that our clients need to wear a face mask when going places. Our clients, some of them have been using the same disposable face mask for a few weeks now. So when they come by our office on Fridays for mail pickup, we've been able to provide them with masks that have been donated and gathered by Chrysalis, which is amazing. Another big trend, which I'm sure many of you on this call might also be experiencing, is the layoffs and decrease in hours, as Mark mentioned earlier. We have a ton of clients applying for unemployment benefits, but those, because of the backlog, they haven't been receiving that yet. And many of our clients also haven't received their stimulus checks, so they are financially burdened right now. But something that truly has stuck out to me is the isolation our clients are experiencing. Many of our clients are already experiencing some type of isolation, whether that's lack of family support or professional network, or even just friends. So our clients are living in solitude, whether or not they have a home or are living on the streets. So there's this need to connect to people. And since the support and connection they typically would have, like our Chrysalis centers or the public libraries, are physically closed. And many people just want to talk and they just want to be heard. So I'm seeing and hearing that there's a need for support groups and access to counseling services, which we're lucky enough to provide at Chrysalis. At Chrysalis, we are definitely doing our best to help people feel connected to our community. And as a service provider, I'm sure I can speak for my team too, this weighs the most on us, the isolation that our clients are experiencing. Chrysalis is known for being there for people at times, and we're sometimes their only support. And COVID-19 has somewhat taken that away. A phone call is great, yes, but that in-person connection to staff and other clients is truly missed. To help give a little bit more insight, I have two quick examples of two different clients that I've been working with. So I have one client, he was working at LAX but was furloughed a few weeks back. And this weighed on him a lot because he has a son that he financially takes care of that lives out of state. And he wanted to get to work as soon as possible. So we went job searching. He was lucky enough to find interim employment through our social enterprise with Project Roomkey, which is amazing. So while he did that, I tapped into our employment network that we have great relationships with. There was an opening, and after 2 virtual interviews, he got a job at a community clinic and will begin next week, and we're really excited for him. I should also mention that this particular individual is also experiencing homelessness right now. And then I have another client. I've been working with her, or she's been our center for the last year. She's also been living in shelters for the last 10 years. She was also someone living with mental health. This has been a challenge to navigate in the past in holding down a job. So when our offices first closed about 7 weeks ago, we hadn't been able to get in touch with her for the first 5 weeks. But when we finally got in touch with her, we learned that she was staying at a pop-up shelter. So she wasn't on the street, which was fantastic news. But for her, her only access points were school and Chrysalis, and she didn't have either now. So last week when she came to the office to pick up her mail, I was there and we spent a good 20 to 30 minutes just chatting and catching up to see and just checking in with her. And she expressed that she truly was at a loss with nowhere to go and unable to move forward, but she was extremely thankful that she was able to still connect with us. So this is just a little bit about what I've seen and heard from our clients and my team in Santa Monica. We have people in some really tough spots right now, but they're all maintaining hope. So with that, I'd like to welcome David Milian, who works at our center in the San Fernando Valley.
Okay, hello everybody. My name is David. I've been working at our San Fernando Valley Center for 8 years now. A little bit about my day. As an employment specialist, I'm starting each day with reviewing my caseload. What am I going to follow up? Who am I going to follow up with? Who do I need to contact again? I'm also taking a moment to look at the market, see what's hot, see what job leads are open, and checking on those leads with my fellow staff members just to confirm. I'm probably speaking to 8 to 9 people a day. You know, sometimes I have to give my phone a break because the battery gets too hot. Too much conversations, but they're good, positive conversations that are happening. With clients, I'm speaking a big part of our time on where can we find affordable housing, also limitations on access to technology or the internet, and getting basic needs met. So I'll give you an example. In the San Fernando Valley, I know that many clients are working, but they might be living in their cars. When we're talking on the phone, a lot of conversations is about what to do to get connected to housing opportunities. If they are working, they're also very concerned about making sure that they're safe and healthy in their workplace or at home. That's one of the common conversations that happen. Besides access to technology, using technology is also something my clients are navigating. Have many calls that go straight to voicemail, but I leave a message because I know that their phone is more likely not to be charged. So I generally hear back from them once they get their battery charged. For other clients, using the computer or going through emails on phones can be tough. So I do spend some time each day helping people with their emails or completing online applications for them. And like Bianca said, of course, if they're comfortable with it. I'm definitely spending time on covering basic needs with clients, but job search assistance is still at the center of what I'm doing on a daily basis. I'll give you an example. I've been working with a client since November of last year. He had previously worked as a video and graphics editor. He moved from Brooklyn to LA. Finding work in his field was actually tough for him. In addition to that, the employment gap started to widen and increase. So in addition, he also was experiencing homelessness and currently still is in an unstable situation. as he's primarily finding places to stay through Airbnb. And so one of the greatest things about working or about Chrysalis is that our transitional jobs program could get someone in various situations stabilized as they work through their job goals. So I referred this person to our works program. He started to work with one of our crews, but some of the hours decreased due to staying safe during the pandemic. In response to this, our social enterprise teams found a new contracts that would create more job opportunities, especially for people like this client who has been working in this transitional job, that those hours had to be changed for the time being. As an organization, we started working with Project Roomkey, and this person is now working shifts at a shelter in Canoga Park. I was super happy to hear it and for him to start working. He actually told me this incredibly great quote saying that he was really moved by the work he was doing, and so was I. So I had to write it down, share it with the team, my coworkers, and now I get to share it with you all. And he said, quote, "I have a high volume of appreciation for Project Key and to have a job that contributes to the housing crisis. The level of impact of my job is immediate. Everywhere I look, I see commitment from everyone who works here." And with that, I would like to invite Josh from our downtown Los Angeles Center to share.
Thank you, David. Thanks, everyone. My name is Josh Kazahin. Try and say that 3 times. Very not easy. I'm the interim site director at the downtown Los Angeles Center. And similar to what Bianca and David have shared, we're just seeing so many of the same stories in our downtown center as well, just as we're seeing in Santa Monica and San Fernando Valley. So food insecurity, for example, is one of the biggest things that we're noticing in downtown. I reviewed the requests for support from our downtown clients and found that approximately 67% of requests for emergency needs have been for grocery cards. And the benefit of the funds that we received is that we're able to deliver these as an e-gift card or in any capacity that the client can receive them so that they can access them immediately. And many times clients are reaching out to us for these resources because they've exhausted all other options, or maybe the food center is now only doing drive-through, or the pickup appointments, or things that need to be coordinated in advance that may not be easy for some of our clients. So that's been one of our biggest things that we're noticing. As I mentioned, 67% of requests have been for food in the last 3 to 4 weeks. The other large categories are related to transportation and phone assistance. And again, this is another thing that we're able to provide thanks to all of our partners in the emergency fund that we have, whether it's a gas card, paying someone's phone bill so that they can get to an interview, or if they're working overnight and they're not able to access Metro, providing Lyft codes. Those have been such a huge benefit to our employment specialists and our clients to be able to provide with this assistance in this critical time. The third category that we're noticing, very similar to what you've heard, and the housing crisis, I think, is not news to anyone here. California is facing it in such a big way, and housing instability continues to be one of the largest barriers for our clients. And what is particularly different this time around is the complexity of accessing services when so many manual doors are open, right? Or so many, I should say, so many manual doors are closed when they used to be able to walk into these services. So just being able to walk clients through these, the various rec centers that may be open, or the shelters, who's open right now. And our employment specialists, as David mentioned, their phones are staying so hot because they're really just connecting clients to various opportunities, working with our partners like LASA. But in addition, sometimes when those options are not available, we're then able to provide hotel vouchers or something like that so that clients have somewhere to go in times of crisis. I really ultimately cannot stress just how hard everyone is working to keep each other safe, whether it's in our enterprises, our employment specialists, sharing information and knowledge, and of course, all of us as a community. That's our top priority. But one thing that we know is that positive tests do happen. And if this happens in a shelter, for example, something that we're learning about recently is that individuals are then moved to a quarantine. Measures are taken so that people may isolate themselves. And the truth is that can be very traumatic and triggering for a lot of our clients. It's viewed more as a lockdown for them. So our employment specialists, once again, are able to assist clients in those situations, including referring them to our on-site counselor, who's still offering services at least twice a week, and those are all over the phone. So we're just creating that connection and that dialogue going between our clients, and it's been so meaningful. Just as a last story, I know you've heard a lot of stories tonight, and I just really thank you for taking the time to join us and hear our stories, is that one of our employment specialists was working with a client that recently tested positive for COVID. And obviously it was a very difficult situation. And as the situation evolved, she was initially not symptomatic. And then as she developed symptoms, it was just amazing to hear and see the interaction, including our external relations team that had resources up to date on our internal website, so that the employment specialist is able to say, you know, you can do this, or these are your options, and you've been laid off, so these are applications we can support you with. And so the client just felt connected to their employment specialist the entire time. And then thankfully, in this case, the client has recovered. We just received the news on Monday, so that's great news that the client has recovered. And then in this point now, the employment specialist is then able to say, what do you need to get back to work, which is medical clearance and some of those things. So the employment specialist is then able to walk them step by step and get them back to work. And we hope that person will be returning to work in the next week or so. So these are just some of the stories that we're hearing, the resilience of our clients and our staff. Many of our employment specialists have 120 or more people on their caseload. So maintaining that level of contact and just really being there in an empathetic ear, and also caring for one another, taking time to self-care, all of those things that we all should do every day. Being able to do that and also provide services to our clients has just been so impactful. And me personally, I've just been amazed just at the resilience of our team and our clients. I want to let you know also, our virtual doors are open, and we're noticed in the downtown just in the last 2 weeks since we've been open, we're averaging at least 6 to 8 clients a day, which is just really a testament to the needs that are out there, as well as we know that this is going to continue to increase as more the word gets out. So we're just really thankful for everything that's taking place, and also to our clients for continuing to trust us with the services and our partners. That's a little bit of the story that I want to share. I believe Tiffany will come back on screen and help facilitate some questions.
Wonderful. Okay, that does conclude our updates for this broadcast, but please stick around. Right now we're about to move forward with our Q&A portion. So I'm going to take a moment to invite all of our panelists to turn their cameras back on. I'll also be inviting a few of our VPs who are in attendance tonight to join us as panelists to address any questions that may come up that they can speak to. So just give us a moment. If you didn't already submit your questions, Sherlock, maybe we can see Sherlock, my dog, instead of what you're supposed to be able to see. That's my dog. So we are going to move forward with the Q&A. Thank you to those of you who did submit questions, and if you have more that pop up, let us know. All right, so you should be able to see our panelists. I'm going to invite Mark to turn on his video, David as well, and
hey, I can't turn my video on, Tiffany. I think it's blocked by you. Oh, there we go. Now it's working. I don't take offense to that at all.
I'm still mastering the music guru hat. Okay, wonderful. So we are going to kick it off with our first Q&A question, which is, how are staff doing during this time? What are staff needs? And so I'd like to invite Bianca. Would you be able to speak to that?
Yeah, thank you. Staff are doing okay, but staff also understand that we are not saving people, but we can only help them, and that we have a capacity. And so when that capacity and threshold is met, that they need to check out by taking a mental health day, taking 2 days here, maybe a 4-day weekend. But overall, staff are doing well. And I think that we work with some amazing, empathetic people that they want to be on all the time. So I think for me personally, I've been managing my team by saying, when you are off at 4:30, please be off at 4:30. And I catch them sending emails at 6 o'clock or 7 o'clock at night. So just reminding them that for us, it's really important that we are also taking care of ourselves, but also for our families too, because just like our clients, we're all going through some things as well.
Thank you, Bianca. Okay, at the beginning of the broadcast, Mark mentioned that we have 90 clients working at Project Roomkey across LA County, and we've had a couple of questions come in about that. I'm going to ask Trevor Kale, could you help answer what are our clients actually doing and what roles are they filling for Project Roomkey?
Yeah, we've heard a lot about it tonight. When we were initially asked to do this, the thought was that we would kind of deliver things to rooms and basically when, if there's food deliveries, if there's food prep help that needs to be happened, basically whatever's needed on site. And that's kind of what it's become. I think something more interesting that's become of our work there is that, and David mentioned it with his client, these teams are working in a chaotic kind of environment that was thrown together really, really quickly, but is providing like an unbelievable service to people in need. So really what the cities in the county and the state are trying to do is house people who are in the at-risk category. They're asymptomatic, so they're not showing any symptoms, they're not testing positive, but they want to have non-congregate shelters. So rather than putting them all in a recreation facility, they've got their own individual hotel rooms. So that was thrown together really, really quickly. And I'm just amazed at the stories we get back from our clients about the people who are on site, gelling very quickly of a team of 5 or 6 people who are making these operations run. And for our clients, it's an amazing customer service opportunity. They get to be a part of a team. We've got, like Mark said, 110 people working there this week and more orders coming in all the time. So that's kind of the day-to-day.
Wonderful. Thank you, Trevor. Our next question, and we have time for about a couple more, is how is Chrysalis addressing to a shift in client needs and what they're asking for? And I'd like to ask if Molly Larson could speak to that.
Sure, thanks. Yeah, so we are definitely seeing a shift in needs, not only for current clients, but also new clients that we're welcoming, as you heard my colleagues talking about. So there are a couple ways we're addressing it. One is in flexible funding. So we have more flexible resources thanks to the generosity actually of a lot of you who are probably on this call with us right now through our COVID relief fund that runs through the end of this month, I believe. But our employment specialists have at their fingertips larger, more flexible resources than they have ever had. So we're able to meet clients where they're at, give them the grocery cards, pay for phone bills to make sure they're staying connected. But we can't do it all. So we do have a network of partners that we work very closely with. We have our external relations team that continues to find what resources are available in the community so that we are able to connect clients that way. So a lot of what we're working on now is just figuring out who's offering what in this new virtual world, and making sure that we get clients connected as quickly as we can with what they need. And I'm sure it will only continue to evolve as this entire situation evolves.
Thank you, Molly. Our next question, I'm going to toss it up for Josh, Bianca, or David, is are your clients getting enough substance use and mental health treatment? Could one of you guys speak to that? It looks like Josh maybe wants to answer. We'll get you unmuted there. Unless I just volunteered.
No, that's good. Yeah. I could start there. I know that a lot of facilities are still open, but recently some of the ones near downtown did have positive cases. So they were in essentially isolation or lockdown. So that's really made it difficult. So there's been some that we've been able to refer to, but not as many as we have seen in the past. So I think that one center, for example, in downtown shutting down permanently, or at least for now, temporarily, has been an impact for us. So that's something we would like to see more of, and maybe Bianca can add to that.
Yeah, we have a great partnership with Claire Matrix, and they are open and taking referrals. And we've actually just this week processed one on Monday for someone that was looking for treatment, which is fantastic. And then all of our centers have on-site or not on-site, but we have virtual counseling now, which is amazing. And they have the capacity to take on more support if clients are needing that.
All right, we're coming right up on 6:30. We do want to end on time, but we do have a question about in-kind donations. So Suzette and Antonio, we will follow up with you about that. So thanks for that question. Thank you all for tuning in. Before we sign off and before I pass it off to Mark, I want to invite everybody to join us for our next broadcast on May 19th. I'll be sharing that RSVP link to register in the chat for you. And with that, thank you. I'm passing it off to Mark.
There we go. Thank you very much, Tiffany. Thanks for all of you for joining us tonight, and thanks to Bianca and Josh and David for sharing a bit of what your life looks like these days, and hopefully all of you have a better understanding of not only what our community needs, but also what our staff is up to. I couldn't be prouder to lead this group of nearly 200 professionals that are just turning the world upside down every single day in really difficult circumstances. So thank you to my team that's here. One last thing I wanted to update you on, and Molly Larson mentioned this a moment ago, our COVID-19 Relief Fund has really been an important tool for us to provide direct support to our clients. And thank you, those of you that are on the call that have supported this. So with the help of that fund, as well as some generous contributions from donors through other funds, we have been able to get $67,000 directly in the hands of clients over the last 6 weeks. This is in the form of grocery gift cards, paying utility bills, credits to travel on Lyft, and in some cases, direct cash payments to clients so that they can decide how best to use them. That's impacted over 400 of our clients and their families. So without the support of our community, we wouldn't be able to do this. So thank you so much for those of you that have done it. And I wouldn't be doing my job as a fundraiser if I didn't say, if you're moved by those stories and you'd like to continue to help us build that momentum, please visit us at changelives.org. Gee, there might be a donate button there where you can help us. But seriously, thank you all for continuing to support our work and talk about our work in the community. And we'll look forward to seeing you next time. Thanks, everybody. Have a good night.